Number one rule is there are no rules.
And what are the biggest challenges you envision right now for the startup development?
I think it's unpredictability. You can be great in everything, but in case if you are not having the right hand chunking done, then you might be, a screw over.
This is one of the hardest market to operate. As a patient, with the help of your product, I can get more guided decision from my side.
As a patient, you get the guidelines on the how personalized, how good is your treatment.
User gets the cautions about the treatment, including possibility of personalization, highlights of drug interaction and treatment relevance in general.
Dear investors, if you're listening to this podcast, I think that you got the right hint here. Hello, everyone. Welcome to the Seeds of Bravery podcast, and I'm its host, Oksana Krikun. And I would love today discuss, as in the previous podcasts, deep tech startups and their journey. So today I'm joined by Maryna Korshevniuk, who is the founder and CEO of Apixmed. Apixmed provides quick access and protected storage of your medical records. So today we will get more information from Maryna about the startup, the business model, the founding team, and far more. Maryna, thanks for joining today.
Hello, Oksana. Nice to meet you, and thanks for having me today.
Awesome. It's my super pleasure to talk to you today because I'm really interested in everything related to the medtech, health tech, biotech stuff. And, I was kind of waiting for our talk today. And especially, I will be asking you a lot of questions in terms of the industry trends and far more. So thanks for coming once again. And I would love to start with a question about probably your background and the founders, because the founders are making the startup work and it's your vision. So tell us more about your experience and probably the founding team.
So I will start with myself. By my background, I'm a scientist, bioinformatician, strong track of records within the biomedical field for both lab processing and data analysis. And it's kind of my biggest inspiration of my life. So at some point, I decided to convert this passion and the scientific interest into the commercial sphere. And that's how we found Apixmed together with two amazing technical specialists, Evgeny and Andriy. So basically, our team in the co-founder level consists of the strong biomedical expertise, advanced skills in the software development, and also infrastructure deployment for complex solutions such as knowledge systems and some complex algorithms for big data processing.
Oh, wow, that sounds really cool. And may I just dive deeper into your experience of founding the company? So you are a scientist and you were working in fundamental science or practical one?
Fundamental mostly.
And this is kind of an amazing case. When you decided to, start your own business, what inspired you? Which moment in your life defined this thing that you said that, no, I want to go with a business role right now?
It's an interesting recap because with my first semi-commercial experience, I started when I was on my bachelor studies in Ukraine. And it was one of the projects which was a winning idea of the Falling Walls Conference. It's one of the biggest conference for innovations in Europe. And basically it started, and all of this entrepreneurship spirit started from that point, which was, I think, in 2017 or so. So basically I was young and also already attracted by the idea that scientific research can be translated into some industrial cases or commercial services for the best of usage from the audience as well. So after several iterations and trials with my own ideas, Apixmed started. So basically with this, all of the entrepreneurial mindset in combination with science and the scientific perspective, I started kind of 8 years ago. So yeah, it's a track.
Wow. And where did you meet your co-founders and how you decided to find like these specific people and them to your team?
So the moment the idea of Apixmed was created or appeared is actually the crucial moment of everyone's life, I believe, because it was at the beginning of the COVID-19 pandemic. So that's why we were all discussing with our teammates or friends all of the challenges that the population world is facing right now. So at some point I was talking to a friend of mine, Evgeny, and we were kind of brainstorming that actually it's very disappointing that the medical system in general is not able to handle all of these challenges at the moment. There are several optimizations that we can provide in order to reduce this burden of this, the number of the patients as well as the optimized healthcare and disease treatment. So that's why we started with just a brainstorming idea, conceptualizing, sharing some ideas, because Evgeny has a strong experience in developing the medical software. So at that point, I was sharing my kind of scientific expertise, purely insights from the global trends and the point of view how it's done in Europe or how it's done in other countries and how it can be done in Ukraine in particular. And Evgeny was saying, yeah, actually we have some tools for that. So at that point we decided, let's try out to found Apixmed and see how it goes. And that's after that we realized that we need a third person to rely on in our little startup team, and that's how third co-founder joined us. But we knew each other from the student time, from the basically Kiev Polytechnic University and some related stuff.
Wow. And who is responsible for what right now in your team? I mean, like in this C-level team.
In general, all of the main decisions are made jointly on this kind of democracy level. So basically to have some particular strong decision, maybe have 3 out of 3 votes to be provided. But ideally, we share the responsibilities in the way that I'm taking over all of this visionary stuff, also the scientific development, the consideration and testing of the new approaches, as well as new directions. I coordinate partially the product development in the way it is in between my and Evgeny's responsibilities. And out of 2 other co-founders, they both responsible for parts of the software infrastructure as well as backend and frontend. But Evgeny also, as the Ukrainian representative of our team, takes over all of the administration. So we share the responsibilities, and we try to not to take over too much outside our expertise. And we also do our best in order to facilitate the kind of onboarding of the service provider to cover some of the startup needs. So we do not try to do something we do not necessarily can do in general. So that's, I think, the benefit of our team, that we decided that we stick with our expertise and try to do as much as we can outside this. But if it takes too much of effort, we try not to dilute the focus and do things we do good, not take things that should be done. So that's kind of a long story short about us.
Wow, that sounds really amazing that you're focusing on your capabilities first, and then, like you're like an architect, not even like an architect, but a sculptor. You are like diminishing everything else, which distracts your focus from what I'm hearing right now. And that's
true.
that
That's what we
sounds
try
really,
to do also. Yeah.
yeah, a dedication. And how many people do you have apart from your founding team, and which functions do you have?
So basically, our team is 7 people, considering people who work part-time with us and full-time. And also we have a wide list of advisors and people affiliated, like a partnership and other kind of team members, external team members. Most of the team members we have outside the C-level are in the R&D department. So they are shaping our solution from the scientific perspective, as also validating algorithms and finding new evidences to enhance and improve our current knowledge base. So mostly these are R&D people with some other technical or biomedical expertise.
Yeah, you're a quite science-based startup, so
Yeah, we are.
And I jumped into the team because I'm the person who is a pro team, and I believe that great teams can make great products happen. And let's right now get a little back and let's talk about the product itself, because of course you are working in the patient's data and protected storage of data, but let's talk about this in form of the industry you're operating in right now. As I understand, this is more close to precision medicine stuff, where you're getting the precision treatment and you're helping people to get this precision treatment. So correct me if I'm wrong here. And also, let's talk in simple terms what your startup is doing for people who are not that much into this industry. They're either from other industries or can be potential users of your startup.
Sure. So I think we are tackling the need of everyone. So basically, none of us wants to suffer from the adverse drug effects or some inefficient medical decision that the clinician can make for yourself. That is why what we do, we analyze the medical and genetic data of a patient, sometimes also some other biomarkers if this data is available, in order to reanalyze it from the expert view perspective and provide the feedback on how personalizable, how efficient, how safe is this treatment for you, and what can you do in order to increase the treatment efficiency in the way that it's sometimes some lifestyle interventions are needed, or some auxiliary testing like knowing your genes which affect how you metabolize several drugs is needed. So that's what we do. We indeed store and analyze medical data, but also we are able to process on this on the advanced level your genetic data if you have one, or point you to the need that you actually have to have your genetic data because your condition and the treatment approach is relying on the efficiency of how well your genes metabolize something. So that is why we analyze medical and genomic data and provide you with informed decision in order what can you do. And knowing this, you can also understand that sometimes patients do not have that much right to make this decision. So we shape our solution for both patients, but also clinicians in order to finally get the efficient treatment on both sides from the compliance level and the decision-making level.
So does it mean that as a patient, with the help of your product, I can get more guided decision from my side where I can make the decision, or I can ask questions to my medical, like to a doctor, where like, why are you doing this treatment? There is my data, kind of that stuff. And on the other side, there is a doctor who might have my medical data and I can have a second opinion on how to treat me better, and or not even a second opinion, but additional data which make the precision of the treatment for me.
Yes, indeed. So it's basically exactly these two directions that you just highlighted. So it's, as a patient, you get the guidelines on the how personalized, how good is your treatment. So it gives you safety, and also what exactly can you do to increase the treatment efficiency. So this one part. And for doctors, it is indeed a proof check and also the kind of fidelity check that actually this treatment is compliant to several guidelines, or the guideline he or she has been used to is up to date. So here's the new information that you may consider to provide a better treatment right here, right now. So yeah, and that's why we so far focus mostly on the clinicians because indeed, as we started this discussion, that the personalized medicine and precision medicine is an emerging field, and there are not that many people who are actually fully understanding this concept and who are ready to apply this even on the clinician level. That is why we tackle the clinicians to like pioneer our solution in general trends of personalized medicine, and further we provide these insights to the patient as well, but as the second focus.
Can we talk a bit more about your clients, if you can, like highlight at least some, and about the level of the technology? Because from what I hear, you're already working on the market. So it's already like tested technology, which you are selling to the clients. Okay. So who are the clients if we are talking about the clinicians, as well as have you developed already the B2C solution if we are talking about this client, like business to client segment?
So far, Apixmed indeed operates as the B2B SaaS, and we tackle such a segments of business clients like the hospitals and other healthcare providers, but also the labs such as genetic laboratories or genetic testing labs around Europe and Ukraine. So I cannot disclose due to the agreement options the exact names, numbers, and so on. However, from the client's perspective, we have 10 plus business clients. The biggest one is the genetic labs, several of those in Ukraine and in Europe in general. And now we are kind of improving and trying to make these bridges between two of them closer. And then to answer the question about B2C, we are indeed developing the B2C solution, and it's available for free on apixmed.com. However, we are polishing this up in order to make it better, make it more usable, because Apixmed works the best only in case if you have full set of the data. Like only having this part of the diagnosis on treatment schema is sufficient, but it's not enough. That's the point.
And concerning B2C, just to understand, so you're gathering this data to make your model better trained, or for which reasons? Or it's your social component? How do you envision?
I would say it's community/social component. We do this just for people to elaborate the message that actually using your information, not just storing your medical data or not just having your whatever 500 euro genetic test somewhere else on your laptop, it's not efficient, and this data can be used for the better. So that's why we do this, and we hope that together with this global trends that people are much more into their health and well-being and much more educated in the way to analyze their data, together with these emerging trends, we will be able to provide the biggest value for people and even prevent disease in future. So basically we aim we aim to solve and manage complex conditions, but for future is remove all of this trends of chronic disease. So like minimize as much as possible trends with chronic disease and focus only on the well-being and the healthcare journey, not the sickness treatment.
It looks like you are adding a lot of value to this ecosystem,
We
like
hope to.
yeah, hopefully. And let's talk about the competition, because obviously
Mhm.
if there is a problem, there can be several
Yeah.
teams for solving this problem. So who are the competitors right now, to your opinion, and why you are better, or in which point they are better at this moment of time, or why you are different?
Depends on the market we consider, but if you talk about global solutions, there are indeed several companies which provide the comprehensive data analysis. So there are two types of companies like this. One of them, those is focusing on the deep phenotyping, multiomics analysis of patients or like particular clients in order to provide the treatment for the complex and some comorbidity cases or complex conditions. This is one segment, and usually their downside is that they are focusing only on the limited list of diagnoses or healthcare conditions that they can be helpful for. And the second one is in general like analysis of the medical data in providing trends. This is kind of the bigger segment of the market. So it's integration of your variable data, of your genetics, of your medical, and the kind of the limitations of this company is indeed this field in general has just started and they are not kind of doing their job that great. There are several limits on the market and as well as on the organizational/regulatory space. So we are kind of in between those, I would say mostly to the second segment, and we are kind of over bidding and kind of winning this, from my perspective, this solutions through the advanced technologies of the data integration, data analysis. So that's kind of our secret sauce that we provide.
Good to hear that. So, dear investors, if you're listening to this podcast, I think that you got the right hint here to contact Maryna and her team and to get to know more about the product. And in terms of that, like if you are doing this stuff somewhere in between, let's talk a bit more about the stage you're in right now, because you're already selling your product to these hospitals, to these diagnosis institutions. But at which stage are you right now, and what are the key challenges you have right now in your product?
So if you talk about the technology landscape and the stage of technological development we are in, it's definitely above TLR 7. However, if you talk about the investment, Apixmed is partially self-funded and also funded by non-dilutive grants and support, in particular from Seeds of Bravery. And we are now having the organic growth and also the stable revenue, as well as already shown the return of investment from the funds we allocated for this project. And we are ready for we are preparing for the fundraising for the seeds round at the summer or end of this year. It's under consideration. And why we need to fundraise and what is our kind of motivation to allocate some auxiliary costs? It's only to speed up our organic growth and also being presented and incorporated to other markets such as North America, US market. That's the main motivation we have.
Mm-hmm. And when you mean by presented, so do you plan to spend this money more on marketing or efforts and sales efforts, or more on the product development and technology development? If you can share, of course.
Yeah, sure. So there are several. It's a minor proportion of this is indeed the technology and product development. However, as new markets requires some adjustments on the regulatory perspective, as well as kind of, let's call it proper phrasing around the bureaucracy and the legal documents you have and the positioning on the market, it's part of that. So indeed, to get the higher level of compliance and be ready to be incorporated smoothly in the, for example, US hospital system or healthcare system, this is the part where we need money. Of course, marketing and the lead generation, proper customer development is needed and will take some proportion of the cost. However, I would say this kind of is difficult so far to decide now because we have been doing this lead generation in the US already, and we see the positive trend, but we are not that sure that this trend is well extrapolatable for for global US market. So we need some costs for the testing and also scaling up of our current activities.
Mm-hmm. And what are the biggest challenges you envision right now for the startup development?
It's an interesting one. I think it's unpredictability. That's all we learned from last 4 years. First, we started unpredictability. I mean, this is the challenge that is like, even though there are several trends, for example, personalized medicine became a trend like more than 12 years ago. It's still not well adopted around the globe. So you have a trend, but it's not matching the reality. So that's what I call unpredictability and unmatched expectations. So that's how I would consider as the something, it's difficult to expect and difficult to tackle. So from technology stack, I don't see any limits. From the bureaucracy, I don't envision any problems with proper compliance in case if we need to be certified for several cases as a medical device or something like that. But I do believe that something that I might not be aware right now might make some problems for me. That's kind of the honest answer.
Yeah, that's really interesting that you are talking about that because, precision medicine is a trend which is there for a long period of time, and you are operating in this. Do I understand it correctly that one of the key challenges about data, like how you get this data, how you store this data, analyze this data?
No, that's not. That's actually solved. I would say it's definitely complicated, but overall, in this ranking is definitely the least problematic thing to tackle. So what I would say is that as we operate on the healthcare market and in general within the healthcare field, it is difficult to kind of join the fair competition there. So yeah, this field is very well regulated. There are some unpredictable. You can be great in everything, but in case if you are not having the right hand checking done, then you might be a screw over. So that's kind of it. But it's not only that. It's not about talking about some lobbying or like well regulated markets. It's also about some unpredictable trends. Like now, we all understand that the precision medicine and genomic data is the key and can open a lot of doors for the optimization of treatment. But sometimes, at some point, the new technology might appear with the better outcomes, and then everybody will be adopting this technology. So, in the well-regulated markets, such as or like spheres in general, such as medicine, some so law procedure, like the all of the market of advocacy, there are some trends that you cannot change, and there are some rules that you cannot play around. It's not like whatever B2B SaaS where you do some other like things for fun, which are or like things for useful stuff, but they are less regulated, and you have much more freedom there. So that's what I call by unpredictability. So you know some trends, but sometimes just like a veto is set up, and you cannot go further.
Yeah, of course, this is one of the hardest market to operate because it's very closed and there are plenty of big players and a lot of different things which are you are operating in the ecosystem. So hopefully everything will be fine for you in the long term because like the right handshaking, it's also growing from the reputation, and you are
That's
obviously
true.
in
Yeah.
this reputation. Awesome. And
Yeah.
yeah. And if to talk about the market at all, like the industry. So today we are talking, you're working in this precision medicine in health tech and in this well-being. So how do you envision as a professional in this field, as a researcher, as a founder in this field, how do you envision the development of this industry in the next 5, 10, 30 years? I understand that we are shooting for the stars here, but what is your personal overview of this market?
I would say the market will be much more enriched for data solutions, such as the amount of data and the quality of data is rising exponentially. That is why the need of the proper data analysis is there. But even more, the data analysis, knowing that the healthcare field, the medical genomic data are well regulated and protected, the need for solutions that are able to analyze, meta-analyze, combine your data in the federated manner is also here, such as the hospital A with hospital B can share anonymously the data in order to get some common insights and or see the patterns from the disease progression or patients clustering, stratification, and so on. So I would say the healthcare market will be kind of disturbed in the way that the more solutions will have the data as a part, but also the diversity of the data they count, such as like the imaging technologies like MRI, CT, and so on, the some whole genome sequencing, or even some more coverage analysis of the DNA, RNA, and other biomolecules will be there, and some more advanced biomarkers for predicting the disease prognosis or diagnostics will also take place. But you have to have facilities for both properly analyze the data, properly generate the data, make sure it's all standardized, and make sure you can gain the insights from all of these oceans of data points. That's at the last point, I would say this is the sweet spot where Apixmed is aiming to operate. So kind of finding the insights from this majority, or like, just the bulk of the data, I would say.
And after we will find these insights, what will happen next?
Oh, if we talk about if we dream,
I mean, like we are gathering data for something. It's not like just to have insights, and insights will influence something else. So what it will be, it will be the final question on this trend.
Sure. So what I envision is that as soon as we are able to reach the point when the decisions are more helpful, the costs are then further more optimally distributed, like costs in healthcare. And after that, we are able to kind of talk about the democratizing the advanced solutions, such as like it's not that fair that sometimes some people get the right treatment and some do not for different reasons, such as like, some economical reasoning behind or some subjective trends and so on and so forth. So as soon as we are able to properly operate with data and we have the solutions for doing so, like the hardware ones, that's what I mean mostly here, is the democratizing the advanced healthcare solutions as well as speeding up the development of the new technologies we'll be having in place. And this all about, kind of removing the global enemies or like elephant in the room, such as like cancer, cardiovascular diseases, and making sure that the people are, managing properly their health risk. And also, as soon as they're sick, they are properly treated in the way that, every detail of their profile is accounted for.
To live longer and better lives.
Oh, for sure. For longevity, well-being, and all of these trends, and healthy living, healthy aging. Yes.
Awesome. Sounds really amazing, especially in terms of that we know that some diseases are influencing older people more than younger people. And and there is a ton of financing right now, especially in the USA, in Europe, just to help to tackle some challenges which decrease the productivity of these people. And so to make people work longer, but live healthier and better life in the end, of course. Cool that you are in this trend. I'm so delighted, that Ukrainians and Ukrainian companies are solving this challenge and tackling this challenge right now. And let's talk a bit about the Seeds of Bravery, because you are a Seeds of Bravery participant. So you just mentioned a bit, but can you share your thoughts on what Seeds of Bravery gave you, and probably what you were to take and what you actually took from this program and set of programs?
So it will be fair to mention that before Seeds of Bravery, we were participating in different types of events organized by the other funds providers for the small medium enterprise / startups, and different programs, European Union, from some local ones. And we had some experience in kind of the eye on the type of programs and kind of I would say, intuition to predict the benefits of those. And I didn't expect that, for example, there will be something that I have not seen during different programs I've been participating, like within Apixmed or within other solutions where I'm advising. So I was absolutely excited and surprised in the way what is the quality of organization, how well the people are communicating in the way that they provide the relevant feedback from your questions. They just do not talk, let's call it, about the related stuff, or just like take your time in order to increase their authority or some other parameters, and they do like the right thing at the right moment. So from the insights perspective, for example, I was within the female entrepreneurship track, where I got the amazing mentor who was here also in the Netherlands, and we were networking here. Like, it's just one of the best experience so far from all of these programs, and also insights and further trends. Now we are also in touch to, after the Seeds of Bravery, to keep an eye on the progress. So basically, the mentorship is high quality. The organization of the seminars and events is high quality. I really enjoyed the reporting part in the way that it's like from the technological perspective is well done. So I don't have any complaints. Like, everything was fast, except maybe some minor organizational things which are not on the behalf of us or Seeds of Bravery, just in between. So I am absolutely satisfied from the way it's organized, and I'm super excited that there is also huge list of startups who benefited from this program, because I can imagine it's difficult to find something that can not just provide some financial resources, but also this extremely relevant help for your growth and the development in the future.
Thanks for sharing this, and especially, you're not the only person giving the feedback about the FEL program, which is Female Entrepreneurs Leadership Program. And I love this one because I'm also participating in that one, but from the mentorship side, and I see how crucial it is at some stage for a startup to have a mentor who will be just very into the startup, very much into the startup. And that's great that you have this feedback, and hopefully you will keep meeting this person, and you will become really great connectors in the future as well to have benefit for the startup and for them as well.
That's absolutely what we are looking for as well. So indeed.
Cool. And my last question, Maryna, because this talk is really interesting. I would love to talk more probably about the technology, but we will have to wrap up. What is your single piece of advice for a scientist who is right now somewhere at the stage you were 8 years ago or something, and who is thinking whether to start a startup or no at all? What would you recommend to this person?
Yeah, I would say the number one rule is there are no rules. I mean, there are no universal rules or how do you call it, roadmaps that can bring you to something you envision. So what I was really in need to have is the professional advice from people, or at least just the story sharing from people who are kind of doing the same what I would like to do or just on this path. So how they balance their academic pressure and like some objectives from the research side and the business ambitions. So how they tackle that and that. If it's a spin-off within the university, how to properly arrange bureaucracy, because these are all the details. However, one of them, or like at least one of them, can definitely ruin all of your startup journey. And it's better to think about everything in advance and also find the right team and find the right people to network with. And I would also like this. The second point is that definitely finding the right team to go with through this journey is absolutely crucial and beneficial. It's like number two things, or like number 1/2.2 things that you have to do, because great things are, especially in the biomedical field. I will talk about my kind of expertise within STEM, something which requires hardware, some resources. They cannot be done alone. And you do need team with the diverse expertise, as well as like some tricks to properly handle some administration, organization, to fundraise, to incorporate the legal taxes. A lot of stuff. So make sure you are kind of still excited by the idea, truly understand why do you want to do this. So what is your honest motivation to do something. Don't be afraid to do something just for fun, because doing something for fun with science is kind of the key. And also translating science to business can be fun at the first point and then beneficial or even profitable in the second one. So I would say do experiments not only in lab, and then don't forget that there are no common roadmaps that you might follow.
No common way to manage something. Thank you so much, Maryna, for this amazing talk. Thanks so much for sharing your wisdom and your path as a founder. And to all of our listeners who are scientists who potentially want to start a startup but don't know how, I would definitely recommend the Science to Business program from the US Seeds. This is an amazing program which helps you to understand how to commercialize your scientific advancement, how to found a team, how to find an idea, how to shape an idea. So I cannot recommend this program more, because this can be like the first step to be where Maryna is right now. So it's one of the journeys. It's not like the single one, but still it can be really useful for all of you who are listening to us and who are in a science, starting thinking about their own startup. So that's a piece of inbound advertisement. Sorry, Maryna. And
No, I do fully support. Yeah.
thank you so much for our talk today. It was my pleasure.
Thank you, Oksana. Thanks.
Thank you all. And this was a Seeds of Bravery podcast. Please subscribe to our YouTube channel and other platforms to get to know more about the future podcast, to know more about entrepreneurs and what they are doing.